the introduction of CAR T-cells in multiple myeloma is really accelerating, and this is really good news. In the last few years, we've seen an increasing use of CAR T-cells in acute lymphoblastic leukemia, in non-Hodgkin lymphoma, and many relapse refractory patients are having benefit from CAR T-cells. And we were eagerly waiting for the CAR T-cells in myeloma, and now we do have some strong data regarding at least two constructs, the ide-cel, the BB2121 previously, but also cilta-cel. And these two products are likely to be approved or introduced in the next few months, whether in compassionate use or commercial use. And their results are proving very interesting, because when we look to the data, we're talking about myeloma patient, relapse refractory myeloma patient, who already received a median of 6 lines of prior therapy. So you would imagine how advanced are these patients. And despite being in a very advanced status, to make a long story short, you have more than 90% response rate, including MRD negativity. Obviously, we can argue and debate what is the value of such MRD negativity. Nevertheless, that's a good sign. I think another important feature is a safety profile. Clearly, CRS incidence and severity is relatively very low. Neurotoxicity is also low and manageable. Other usual complications are not really a matter of concern, and the physicians are usually familiar with their handling. But when we look to the progression-free survival, actually, for instance, in the ide-cel product, with the latest data, you have something roughly around 9 months median PFS. With cilta-cel, it's not yet achieved. Maybe it's going to be hopefully or probably higher, but definitely I think the CAR T-cells in myeloma that are coming in the next few months will be key players in the global therapeutic landscape. But what's really amazing is that the field is continuing to move very fast. And when we look into this immune therapy broader picture, actually in myeloma, it's not going to be only about CAR T-cells, but we will have very soon also the bispecific CAR T-cells. And CAR T-cells are directed against the BCMA antigen. We'll have also bispecific directed against BCMA, but we're seeing now bispecific antibodies, T-cell engagers, targeting other antigens. So immune therapy will be really something of great importance in the management of multiple myeloma patients, because obviously these products will move into the earlier lines of therapy. So the whole treatment paradigm, I think, is going to see some major changes in the next 5 years. And all of this, I'm a strong believer, will translate into a survival benefit to the patient.